अच्छा, diagnosis of molar pregnancy. ठीक है, definitive diagnosis made by the histological examination. Second, molar pregnancy, complete molar pregnancy, section ketorage and partial molar pregnancy, section keratage, and plus medical removal. ठीक है, after removal entity profile is recommended quick notes, section keratage and vacuum aspiration of uterine content is preferred because it reduces the risk of uterine perforation and bleeding compared to sharp ketorage. ठीक है, तो ये हम क्यों करते हैं? सेक्शन केराटाजी क्यों करते हैं? क्योंकि ताकि परफोरेशन नहीं हो और एंड ब्लीडिंग कंपेयर टू शार्प परफोरेशन एंड रिड्यूस द रिस्क ऑफ यूट्राइन परफोरेशन एंड ब्लीडिंग। तो इसमें क्या होता है, ब्लीडिंग भी कम होती है, रिस्क ऑफ यूट्राइन परफोरेशन भी कम होता है। ठीक है, इसलिए हम सेक्शन केराटाज करते हैं। एंटी जरूर देंगे नेगेटिव पेशेंट्स को आफ्टर इवैक्यूएशन। पेशेंट आल्सो नीडेड सीजी फॉलो अप टू मॉनिटर फॉर परसिस्टेंट ट्रोफोब्लास्टिस थ्रू तो द पार्ट इजंट ऑफ दिस स्क्रीनशॉट। ठीक है, उसके बाद आ जाता है मैनेजमेंट और एमसीक्यूज ऑन मैनेजमेंट ऑफ मोलर प्रेगनेंसी पैटर्न। ठीक है, 28-year-old woman persistent with vaginal bleeding at 12 weeks gestation ultrasound shows no appearance. What is the definitive method to diagnose molar? Histological method, histological examination after evacuation. ठीक है, what is the best method for removal of complete molar pregnancy? Suction curettage. बेस्ट मेथड है रिमूव। बेस्ट मेथड क्या है? रिमूवल ऑफ मोलर प्रेगनेंसी, सक्शन curettage. Best method for removal of complete molar pregnancy, suction curettage. ठीक है, suction curettage is the method of chance of removal of complete molar pregnancy. A patient with partial molar pregnancy age 16 weeks has a large fetal parts on ultrasound. What is the most appropriate method of evacuation? Medical removal for partial molar pregnancy, suction curettage is preferred except when the size of fetal parts under suction, then medical removal can be used. ठीक है, NTD profile is recommended after removal of molar pregnancy. Which patient NTD profile is recommended after removal of NTD profile is recommended after removal of molar pregnancy. NTD profile is recommended after NTD profile is recommended after removal of molar pregnancy. And which patient RH negative patients, same principle as the pregnancy event. RH sensitization after evacuation of molar pregnancy. What is the most important follow-up investigation? Serial quantitative beta CG level HCG follow-up is mandatory to detect the persistent GTD even though not in your ठीक है, partial molar pregnancy follow-up is considered complete once HCG level return to normal on two separate samples taken at least 4 weeks apart। ठीक है, टू सैंपल नेगेटिव आ जाएं 4 weeks apart, ये पार्शियल मोलर प्रेगनेंसी का फॉलोअप है। ठीक है, if a woman hasn't had chemotherapy she no longer need HCG testing after any future pregnancy। अगर पेशेंट को कीमोथेरेपी नहीं हुई ना, तो हम आगे जाके या अगली जो प्रेगनेंसी जरूरी नहीं उसमें हम तो उसमें हम इस एबिटाइड सीजी नहीं करेंगे। ऑप्टिमम ट्रीटमेंट फॉर जीटीएन, वुमेन विद जीटीएन कैन बी ट्रीटेड विद सिंगल एजेंट और मल्टी एजेंट कीमोथेरेपी। Women with GTN can be treated with single agent or multi-agent chemotherapy। ठीक है, the specific treatment depend on the FIGO 2000 scoring system for GTN assess at a treatment center। Placental site trophoblastoma and ATT epithelioid trophoblastoma are now classified as a variants of GTN because they are less sensitive to chemotherapy surgery and may be preferred tumor। ठीक है, तो PSTT प्लासेंटा साइट ऑफ ब्लास्टोमर इन एपिथेलियल ट्रॉफोब्लास्टोमर आर लेस सेंसिटिव टू कीमोथेरेपी सर्जरी नीड होती है इसमें। अब ये है कि कोई डेफिनेशन है एससीजी द प्रेगनेंसी हार्मोन मॉनिटर्ड ट्रैक जीटीएन एंड मोलर प्रेगनेंसी। एससीजी जो है जीटीएन और मोलर प्रेगनेंसी को देखती है। जीटीएन अ ग्रुप ऑफ रेड ट्यूमर दैट डेवलप आफ्टर प्रेगनेंसी इंक्लूडिंग मोलर प्रेगनेंसी used to decide single agent or multi agent strength of recommendation be stronger evidence, weaker evidence। ठीक है, follow up after partial molar pregnancy। 28-year-old woman had evacuation for partial molar pregnancy। 28-year-old woman had evacuation for partial molar pregnancy, RHCG normalized at 3 weeks according to 20 guideline when hair follow up beacon। 28-year-old woman evacuation of partial molar pregnancy, RHCG normalized weeks according to 2020, which can follow up for considered। Recommendation follow-up conclude once the HCG normal on two samples at least 4 weeks apart. ठीक है 32-year-old had a practical molar partial molar pregnancy 2 years ago managed by vacation only no chemotherapy. She is now 10 weeks pregnant. What is recommended regarding the HCG monitoring? Women who have not received chemotherapy no longer need HCG measured after any subsequent pregnancy event. Treatment choice in GTN 30-year-old is diagnosed with low risk GTN based on FIGO 2000 scoring. What is the optimum initial treatment of choice in GTN? Diagnosed with low risk GTN. Low risk है ना तो इसमें women with GTN may be treated with single agent or multi agent chemotherapy for low risk. Single agent is usually first line. ठीक है 35-year-old present with abnormal bleeding 18 months after her term delivery. Biopsy show the placental site of ovary. She has a low HCG. What is the most appropriate management? C. Surgery as it is less sensitive to chemotherapy. PSTT and ETT are less sensitive to chemotherapy. तो ऐसे patients में हम सर्जरी करते हैं ठीक है. What is the primary purpose of using FIGO 2000 scoring in patient with GTN? B. To decide between single agent with multi-agent chemotherapy. Grade B treatment use is based on the FIGO 2000 scoring system for GTN. ठीक है उसके बाद हम आ जाते हैं biopsy of vaginal mates. Recommendation biopsy of secondary deposit in the vagina is biopsy of secondary deposit, biopsy of vaginal mates, biopsy of vaginal mates. Recommendation biopsy secondary deposit in vagina is not recommended. A reason can cause vaginal hemorrhage, suspected ectopic molar hemorrhage exactly like another ectopic pregnancy. If a tissue diagnosed confirm ectopic if a tissue diagnosed confirm ectopic molar, send tissue to the center with expertise for pathological review. Twin pregnancy with viable fetus. Management refer to regional fetal medicine center NGTN refer to regional fetal medicine center NGTD center refer to regional fetal medicine NGTD center ठीक है gastroenterophobia center disease center vaginal meds biopsy contraindicated due to high vascularity and bleeding risk ectopic rare management priority is treating the ectopic first then GTD follow up high risk need joint care fetal medicine for the viability baby GTD center for molar component twin with mole high risk need joint care fetal medicine for viable baby and GTD center for molar component HCG monitoring vaginal meds in GTN. Biopsy of secondary deposit in the vagina is not recommended due to high risk of major hemorrhage. Diagnosis and management are based on HCG and imaging ectopic molar. Confirm ectopic molar pregnancy tissue should be sent to the center with the expertise for pathological review. Initial management is likely any other ectopic in twin pregnancy with viable fetus coexisting molar pregnancy refer to the regional fetal medicine center and GTD center. Reason to avoid biopsy of vaginal meds deposit. Vaginal meds are highly vascular. Biopsy can cause major hemorrhage. Center involvement in combined molar pregnancy, regional fetal medicine, and involve combined molar pregnancy. Center involvement in combined molar pregnancy refer to the both regional fetal medicine center and GTD center. Okay, thank you guys.